In this lecture, we'll be taking a closer look at the thorax. Again, this is considered to be the chest within our skeletal anatomy. The portion of the thorax that we are going to be looking at refers to the bony rib cage itself, formed by the sternum, the costal cartilage, the ribs, of course, and then, of course, bodies of the thoracic vertebrae. Prior to this, though, let's take a quick look at the sacrum and the coccyx just to finish up the vertebral column. The sacrum, again in Latin meaning sacred or holy, in this case a holy bone, it's a triangular bone formed by the union of the 5 sacral vertebrae that are described by William Bass. The fusion begins between ages of 16 and 18 years and is usually completed by one's mid-20s. The sacrum serves as a very strong foundation to the pelvic girdle, which we'll be looking at as we move into the appendicular skeletal structure, and it is positioned at the posterior portion of that pelvic cavity. Again, the pelvis on either side is made up of 2 hip bones or nominate bones. Now, when you look at, in this case, the sacrum, you realize that it is concave in nature, especially expressed on that anterior side of the sacrum, this which faces the pelvic cavity itself. It's generally smooth and contains 4 transverse lines or ridges that mark the joining of each of the sacral vertebral elements. At the end of these lines, we recognize 4 pairs of anterior sacral foramina. These openings are important because they carry various divisions of the sacral nerves themselves and then the lateral expressions of the sacral arteries. So again, the central nervous system is well expressed here, and of course arterial blood flow is also well expressed in this region. The lateral portion of the superior surface contains smooth wing-like structures, or ella, which are formed by the transverse processes of the first sacral vertebrae, in a sense. So take a look at, in this case, the sacral ella, or these wings, just inferior to the promontory. That's another one of these important landmarks that we recognize and that is used to identify elements of the sacrum. The convex posterior surface of the sacrum is irregular in nature. It contains a medial sacral crest. You have the fused spinous processes of the upper sacral vertebrae which create this crest. And then there's a lateral sacral crest. The transverse processes of the sacral vertebrae are a big part of how that is, in a sense, formed, or at least its architecture. And then we recognize 4 pairs of posterior sacral or dorsal foramina. These foramina again communicate with the anterior sacral foramina through which nerves and again blood vessels are passing. More landmarks, we have the sacral canal. This is a continuation really of the vertebral canal. And then the laminae of the 5th sacral vertebrae and sometimes the 4th, they don't necessarily meet. And so it leaves an inferior entrance to the vertebral canal known as the sacral hiatus, which you can see near the base in this posterior expression. And then on either side of the hiatus, we have these sacral cornua, again, attachment points for ligaments associated with the stability as it relates to the articulation between the sacrum itself and the coccygeal region. We'll see there are coccygeal cornua as well, so they interlock with ligaments. In a sense, these cornua are part of the inferior articular processes of the 5th sacral vertebrae. So take a moment, take a look at your Bass book as it relates to the sacrum. Look at those varying elements how they articulate with one another, and then think about that growth and development and a little bit of their function with regard to the foramina. Then take a moment as well to look at this diagram. So pause the lecture at this point, look at the diagram and the diagram on the previous slide, and then get a sense of really where these landmarks are, to be able to, again, identify them if you were to see them directly, or if there was a virtual picture that you were interacting with as part of an exam. Then when you are kind of reviewing this, make sure to identify that sacral promontory, and then when you identify that, look laterally. The sacrum has very large articular surfaces, and those lateral expressions can be found in the Basque text. These are for articulating with the ilium of the hip bone itself. Posterior to the articular surface is a sacral tuberosity. Make sure to identify where that is located. It contains depressions for the attachments of ligaments in this case, and that is one of those areas that will vary according to sex. The sacral tuberosity again unites the hip bones. It forms the sacroiliac joint, so that's very, very important. And then we have the superior articular processes of the sacrum, again articulating with that fifth lumbar vertebrae. So try to situate the sacrum within that vertebral column, associated in this case with the lumbar vertebrae, at least that fifth. Again, when we look at vertebrae, we're always going a lesser value to a greater value as we move superior to inferior. And then take a look at where and how that sacrum articulates with the innominate bones of the pelvis. Now, when we look just inferior to the sacrum itself, we see the coccyx, again a kind of a triangular shaped bony region that in the adult form is fully fused. It represents the fusion of between 3 and 4 coccygeal vertebrae. Generally 4 is the number of vertebrae that we recognize as being fused in this location, and this fusion occurs between the ages of 20 and 30 years. So it follows a similar track to what we saw with those transverse lines and the sacral elements above it. The dorsal surface of the body of the coccyx contains, in this case, 2 very long coccygeal cornua. They are, again, for ligament attachments that will help with the stability of the region and unite the coccyx with the sacrum itself. On the lateral surfaces of the body of the coccyx are a series of transverse processes similar to what we saw throughout the vertebral column. The first pair being the largest, and then of course as it tapers they become smaller and smaller. These as well represent points of ligament attachment, again for stability. All right, back to the thorax. Again, the thorax is going to represent really the most important element to this particular lecture. As I said previously, the thorax refers to the chest. It's the skeletal portion that includes the bony rib cage, and we'll be taking a look at the sternum, the ribs, and then we will also float in a discussion of the scapula as well, because that's important just by its association, again, superior and lateral to the thoracic cage itself. Take a look at this diagram. What you'll see is that the thoracic cage is roughly kind of a cone-shaped expression, the narrow portion being more superior and the broad portion being identified inferior as you look at the diagram. When we, or if we were able to turn this and look at it laterally, we would see flattening from front to back. We would also see some very unique angles, and again those angles are things that are very much akin to a biped as it relates to the human model itself. The thoracic cage encloses and protects the organs of the thoracic cavity, and the upper abdomen. It also provides support for the bones of the shoulder, and that's why we're incorporating the scapula into our discussion today. Of course, the shoulder then provides support for those upper extremities and their biomechanical movements. We'll start the brief look at the thorax with the sternum. The sternum, or the breastbone, is a flat, narrow bone measuring about 15 centimeters in overall length. If we average all of the sterni across our species over time, it's located in the medial wall of the anterior thoracic cavity. Basically, it is understood as having three parts by anatomists. We recognize a manubrium, the superior portion of the body. The middle portion, the largest portion, is the body itself. And then we have this xiphoid process at the base, the inferior, the smallest portion of the sternum itself. Now, in between each of these sections, so the junction of the manubrium and the body forms what we refer to as a sternal angle. This is important as we look at biodiversity as it relates to this section, this medial section of the thorax. And the manubrium, in terms of its landmarks, one of the really important landmarks to highlight is a depression that can be found along the superior edge or surface of the manubrium, which is this jugular notch, sometimes referred to as a suprasternal notch. On either side of the jugular notch, we recognize clavicle or clavicular notches as well. These articulate with the medial ends of the clavicle bones themselves, or the clavicles. So take a moment and identify where the sternum is. Again, that kind of centrally located series of flat bones. Realize that it is in these three sections. Take a look at what it articulates with, and then take a look at some of these defining features, two of which were in this case highlighted in relation to the manubrium itself. Juxtapose all of this with what is being discussed in the Bass book. Bass does a wonderful job of looking not only at kind of a dorsal expression, or rather ventral expression, but he also then rotates in his diagrams the sternum around, articulating all three bones and giving you a sense of where these costal notches are. Again, points of articulation with the costal cartilage. Now, when we take a look at some of these articulation points, we realize that the sternum itself will articulate directly with some of the ribs of the cage itself, and then also indirectly with, in this case, the 2nd through the 10th ribs. The xiphoid process has no rib attachments to it in a sense, but it provides attachments for some of the abdominal muscles. The xiphoid process consists of really hyaline cartilage during infancy and childhood, and it does not really ossify completely until you reach 40 years of age for the average human. Let's take a look now at the ribs themselves before we get to the scapula. We recognize in the human form 12 pairs of ribs. They make up the sides of the thoracic cavity. The ribs will increase in length from the 1st through the 7th, and then they will begin to decrease in length as you move toward the 12th rib. Each rib is going to articulate posteriorly with its corresponding thoracic vertebrae in order, again, to numbering the ribs interiorly, like the thoracic vertebrae themselves. We count downward from the 2nd costal cartilage, and then we increase in number as we move top to bottom. The first through the seventh ribs themselves have direct anterior attachments to the sternum. We recognize a strip of hyaline cartilage called costal cartilage, costa meaning rib, as being associated with that direct attachment point. The ribs in this case are called true ribs because of their attachment. The remaining 5 ribs are referred to as false ribs because their costal cartilage do not attach directly to the sternum. The cartilage of the 8th, 9th, and 10th ribs attaches to each other and then to the cartilage of the 7th rib, and hence the reason why they're then called false ribs. The 11th and 12th ribs are designed in such a way as that they appear to float. So we consider the 11th and 12th false ribs to be floating ribs. So you have true ribs, those who are more directly connected to the sternum itself. You have false ribs because they're attaching to the cartilage of the 7th rib, and then eventually to the central portion of the thorax. And then you have these floating ribs, the 11th and 12th at the base, because their anterior ends, again, do not attach even indirectly to the sternum itself. So they're only attaching posteriorly to the thoracic vertebrae, again, number to number. So 11th and 12th, T11, T12. Now let's take a look at some of the landmarks of note associated with ribs. And again, these landmarks will relate to a couple things. They'll relate to how the rib is articulating with the spine. It will also relate to the location of the rib within the thoracic cavity itself, its angle, its shape, its size, the expression of articulate surfaces or facets, even ridges. And then it will also relate to how it is articulating directly, indirectly, or again floating as it relates to the central portion of the thorax or the sternum. First, we have the rib head itself. The head is, again, typical or a typical aspect of the rib. It's a projection at the posterior end of the rib element. It is wedge shaped and consists of 1 or 2 articular facets. These facets, again, 1 or 2 of them associated with each rib, are oriented a little differently depending on where you are in that thoracic cage. They again are designed to articulate with the adjacent thoracic vertebrae. So where you see the head and where you see these articulate portions of, let's say, a tubercle, or where you can identify or distinguish the actual neck itself, you're really looking at that portion of the rib that is in a posterior location. The facets on the head of a rib are separated by a horizontal inarticular crest. The inferior facet on the head of the rib is large, and it is larger in a sense than the superior facet. So we'll see some variations there as well. The neck, as I said before, is kind of a constricted portion, just lateral to the head, so as you move away from the midline of the body. And then we see a knob-like structure on the posterior surface where the neck joins the body, and this is called the tubercle. So the tubercle of the rib and where it's located is important as it relates to the neck and when it joins the body of the rib itself. The tubercle is important. There is a non-articular part of the tubercle, and this affords attachment for things like ligaments. And then, of course, we have the articular part articulating with those transverse processes. And it, like the head itself, which has its own superior and inferior faceting, will then articulate with 2 different thoracic vertebral elements. So let's just review this for a moment to make sure we distinguish between the head and the tubercle, at least the articular part of the tubercle. You have the head, you have a superior and inferior facet there that associates with the demifacets that we saw with the thoracic portion of the vertebral column, those above and those below. So it kind of falls on the dividing line between, let's say, T2 and T3. And that would be the head. And then as the shape of the rib in a sense moves or curves both laterally and in a slightly posterior portion, it will then articulate with that transverse process of the thoracic vertebrae. And what we find is very similar to with the head. The articular part of that kind of curved aspect of the vertebrae or the rib itself is going to articulate with two different vertebrae as well. So think of these ribs as kind of falling on dividing lines throughout that thoracic cavity, and at least dividing lines as they relate to the thoracic vertebrae themselves. So make sure to look at that. The body or the shaft of the rib is really important because it helps with siding, and it also helps bioarchaeologists and forensic specialists to be able to understand kind of the superior and inferior orientation of, let's say, a fragment of the bone itself. It can also help angle-wise with the location of where that rib is, because locating the ribs is very, very challenging. It's very similar to what we did with the vertebral column, where you literally have to kind of lay things out to be able to identify where they are. So the body or the shaft of the rib is the main part. A short distance below the tubercle, there is an abrupt change in the curvature of this shaft, and that's what we use to identify and side in the field. This point of major shift is sometimes referred to as a costal angle. The inner surface of the rib has a costal groove with a little bit of a ridge that appears, and this is designed in a sense to protect blood vessels and small nerves that are moving throughout the area. But this costal groove and costal ridge are things that are used to be able to understand where an inferior surface is and to orientate, in this case, the rib, and to be able to side it. So you look for that inferior groove and rib, or ridge rather, and then you look at the angle, that kind of costal angle there. If you have the head, the neck, and that articular or non-articular portion of the tubercle, along with, of course, the end of the rib where we have that kind of connection to the hyaline cartilage, the costal cartilage, we then can use all of those different landmarks to be able to orientate it and to side it, which is important. And they're a great combination of not only the function of the rib in terms of protection and attachment, but also they're important with regard to the overall kind of design of the rib cage itself, a design that's very unique to different kinds of quadrupeds, and of course very unique as it relates to bipeds and their thoracic cavity. Okay, now we'll kind of round out this lecture by moving up and to the right or to the left to look at the scapulae or shoulder blades. These are large, again, triangular in nature. They are flat bones that are situated in the posterior portion of the thorax. In this case, generally between the second and seventh ribs, depending on the size of the individual and the overall length or extent of the scapular body itself. Their medial borders are located about 5 centimeters from the vertebral column and are oriented toward the midline of the body. In terms of some important landmarks that are used for identification and that relate to some of the muscle attachments and some of the biomechanical movement issues associated with this portion of the skeletal anatomy, we represent or recognize rather, a sharp ridge known as the scapular spine. This runs diagonally across the posterior surface and is something that is very unique in terms of its orientation to the architecture of a bipedal or a non-traditional quadrupedal scapular design. There is the body, as I said before, having that kind of triangular shape with the spine again running across the posterior portion of that. The end of the spine projects as a flattened or expanded process known as an acromion process. It can be felt if you are kind of moving your hand to your shoulder and kind of moving just to the top of the shoulder itself and more laterally. You can kind of feel this process. It articulates with the clavicle. Now, inferior to the acromion, we recognize then the glenoid cavity, which its orientation is also very important to the design and functional use of the shoulder in a non-traditional quadruped such as a knuckle walker or a biped such as ourselves. The glenoid cavity, or it's a kind of fossa really, articulates with the head of the humerus to form the shoulder joint. As Bass points out in his work, the glenoid cavity, its shape, and at least its vertical measurement become very, very important in being able to sex an individual or to be able to determine the overall size of the individual and of course the size of their shoulders as well. So a measure of robusticity can be assigned to this location. But as I said before, the orientation not only of the glenoid cavity but also that scapular spine and I guess indirectly that acromion process, these become very important to understand the biomechanics of the shoulder itself and what's being asked of this particular joint environment. All right, then we have our borders, vertebral border or medial border, and then a lateral or auxiliary border. These are thick areas along the edge of the bone itself and generally are well preserved. As you move to the interior of the bone, you take a look at that kind of fossa that exists on the kind of ventral surface of the bone when it is articulated in the shoulder and within the skeletal anatomy itself. What we find is that the center of the body thins quite a bit, can be almost paper thin depending on the age of the individual, and you can kind of see this in this image. I'll expand this image in a couple slides. But then when you again move to those borders, it becomes very thick, and that's where we see a lot of different kinds of muscle attachments and ligament attachments. The medial and lateral borders join together at the inferior angle, so at the base of the scapula itself, which also is quite thick and has a very unique shape. I also mentioned in terms of another important landmark here, the scapular notch. So the scapular notch is a prominent indentation along the superior border near the coracoid process. So if you locate where the coracoid process is, which I'll mention in just a moment, if you look along that kind of superior border of the bone, then you can see where that indentation occurs. The notch, in a sense, permits passage of the suprascapular nerve. So this notch has a function, and it allows to the navigation and, of course, the protection of that suprascapular nerve as it moves through that region. The coracoid process, then, itself is important. This is where we find a number of muscle attachments. It's at the lateral end of the superior border. and it is a projection of that anterior surface. So make sure to take a closer look at where that coracoid process is located. And the coracoid process, as I said, is helpful to be able to determine where that scapular notch is, and then also to orientate the bone itself, and then of course the muscle attachments, which we will mention here in just a moment. Above and below the scapular spine, we find some important fossae, and we see this in a dorsal or posterior view of the bone itself. And we have a supra spinous fossa, and we have a infraspinous fossa. Again, when you think of the name itself, where is that spine? Okay, we have the location of the spine. It has that very unique angle in the human model, and then above that we have a supraspinous fossa or attachment point, and then below that we have an infraspinous fossa or attachment point. Both surfaces serve as, again, attachments for shoulder muscles. On the ventral surface, then we find a much larger fossa if you were to rotate this around. And again, when you have a chance to look at the larger diagram coming up here, so on that ventral side, there won't be a spine, and then you'll see this very large kind of concave area within the body itself, and this is also a fossa, but it's referred to as a subscapular fossa. So make sure to look at that. Now, as I said before, there are a lot of muscle attachments associated with the movement of the shoulder, and of course the movement of the humerus, radius, and ulna of the upper appendages themselves. We will focus just on three because of their importance to kind of broad, gross movements, and they become very, very important in anthropological circles as well. And that's going to be the biceps brachii, the pectoralis minor, and the subscapularis. If you have access to your muscle guide, this was the handout that I provided to you in face-to-face lecture, or something that was posted or sent to you in some other manner, find these particular muscles. So on the first page you can find the biceps brachii. Again, in terms of its general location, it would be anterior to the overall positioning of the body. It would be associated with the upper arm, and it would be associated in terms of an action with flexing and supinating, in this case, the forearm. And the glenoid fossa itself, along with the coracoid process, is associated with the origin of this muscle. So the biceps brachii, an important muscle to associate with the scapula, and I would say even in your notes connect it very strongly to that coracoid process. Beyond this, we have the pectoralis minor. The pectoralis major and minor are very important muscles associated with mammals in general. They're both, again, generally associated with the chest, but the pectoralis minor is a deep muscle. The pectoralis major is superficial, whereas the minor is deep. If you have dissected these muscles out in a variety of mammalian groups, you can even find these in different fish. You'll find that the same orientation generally can be found with regard to the superficial and the deep, but the pectoralis minor is deep. Now it will originate with ribs 3 to 5, and the insertion in this case is going to be the coracoid process, because this is a muscle designed to kind of draw the scapula and the shoulder forward and down. So the pectoralis minor. And then we have the subscapularis. The subscapularis is another one of these unique muscles. It is associated with that very large subscapular fossa of the scapular region itself, the body. The subscapularis is also anterior, and it is something that really is important for a rotation of the humerus itself. So as you're bringing the arm up and around, let's say you're drawing it in a posterior portion rather, maybe inferiorly, and then moving it up superior and forward, you are definitely incorporating the subscapularis, and the origin being that subscapular fossa on the anterior portion of the scapula, and then the insertion in this case is going to be the lesser tubercle of the humerus. So when we take a look at the humerus, you can connect the subscapularis to the moving part, or the aspect that is most grossly associated with, in this case, the action of rotation. That would be, again, an insertion point with the humerus, but the origin is going to be with the scapula. Now, as promised, I am incorporating the image I've been discussing in the last two slides in this final slide, and I'm kind of blowing it up for you so that you can look at all these different landmarks and attachment points and really kind of process through this information. And what I'd like you to do is juxtapose what you're seeing here with the illustrations and discussions in your Bass text. William Bass will take you through a variety of the forensic and archaeological applications as they relate to the scapula, and then he will incorporate a lot of that evolutionary and biomechanical material as it relates to sexual differences, racial differences, the orientation of the spine, for example, in mammals as it relates to the human model, human mammalian model versus non-human. So really kind of connect all of these landmarks with things that he is also presenting to you as well. And then kind of bring both of these resources together, your notes from the lecture itself and then what you're able to draw out of the Bass text. And I think you'll get a really comprehensive and well-rounded understanding of not only the thoracic cavity itself, but also then some of these bones that are closely associated with the thorax, such as the scapula.